Hi, I'm going to be presenting on the dynamic stabilization of shoulder. The dynamic stabilization of shoulder refers to the ability of the muscles surrounding the shoulder joint to maintain the head of the humerus centered in the glenoid fossa during movement. Unlike static stabilizers, the dynamic stabilizers are muscles and tendons that actively contract to provide stability. Functions of the dynamic stabilization. It is to prevent shoulder dislocation, maintain joint congruency, allow smooth movement, protection of soft tissues from injury, and also enhances upper limb function. The dynamic stabilizers of the shoulder, we have the rotator cuff muscles, also known as the sits muscles, which is the supraspinatus, which initiates abduction, the infraspinatus for external rotation, the teres minor for external rotation, and the subscapularis for internal rotation. The function of the sits muscles are to compress the humeral head into the glenoid fossa and prevent excessive translation during movement. For the deltoid muscle function, it produces shoulder abduction and also works with the rotator cuff muscles. During abduction, the deltoid pulls humerus upward and the rotator cuff counters this force and keeps the humeral head centered. Long head of biceps brachii function, it assists in stabilizing the humeral head. Moving on to the fourth, the scapula stabilizers muscle. We have the trapezius, the serratus anterior, the rhomboid, the levator scapulae function. It provides a stable base of shoulder movement and controls scapular positioning. Moving on to the arthrokinematics, the movements we have is roll, glide, and spin. So here we are going to apply the concave convex rule, of which the humeral head is the convex and the glenoid fossa is the concave. Therefore, the roll and the glide, they occur in opposite direction. During abduction, the roll is superior and the glide is inferior. During flexion, the roll is anterior and the glide is posterior and inferior. And during extension, it rolls posterior and it glides anterior. And during external rotation, the roll is posterior and the glide is anterior. And during internal rotation, the roll is anterior and the glide is posterior. The scapulohumeral rhythm is coordinated movement between the scapula and the humerus during the shoulder elevation, of which it has a ratio of 2:1. Moving on to the osteokinematics of the shoulder. These are the movements. Flexion and extension moves on sagittal plane and an axis which is mediolateral. Abduction and adduction, they move on sagittal with an axis that is mediolateral. And internal and external rotation, they both move on transverse plane with an vertical axis. And horizontal abduction and adduction, the plane is transverse and the axis is vertical. Lastly, we are going to look at the mechanism of dynamic stabilizers. Concavity compression, rotator cuff muscles, they compress the humeral head into the glenoid fossa. Hence, this leads to creation of joint contact, improved stability, reduced risk of dislocation. And force couple mechanism is a force couple which occurs when muscles pull in different directions but they work together. Example, during abduction. The deltoid pulls humerus upward, the rotator cuff muscle pulls the humerus downward and inward, hence resulting in smooth shoulder movement and stable humeral head position. Thank you.